What if I told you that there is a medication capable of completely changing the way men experience their sexual life, and that it could also help you with much more than just erectile dysfunction? Imagine a solution that not only improves erections, but can also influence other aspects of your health. Today, we are going to talk about Tadalafil, a medication that has revolutionized the treatment of sexual dysfunction, and we will do it in a way you have never heard before. If you have ever wondered whether this medication really works or whether it has side effects that concern you, stay with me until the end because the answer may surprise you. Tadalafil, which you probably know by its most common brand name, Cialis, is a more modern version of Viagra, scientifically known as sildenafil. Both belong to the same class of medications, called phosphodiesterase type 5 inhibitors. However, Tadalafil has one particular characteristic that makes it unique: its longer duration of action. While sildenafil has an effect that lasts around 4 to 5 hours, Tadalafil can last up to 17 hours, making it a more flexible option for those who want to improve performance without the pressure of timing. This medication works in a simple but powerful way. It increases the concentration of a substance called cyclic GMP, which acts on blood vessels by causing dilation in the cavernous bodies of the penis. As a result, more blood flows to the area, making erections easier when there is adequate sexual stimulation. But here is where it gets interesting. Although Tadalafil has an onset of action of approximately 30 minutes, its peak effect is reached around 3 hours after consumption. This means you do not need to take it right before sexual activity, since you have a considerable time window to be ready when the moment arrives. The standard doses available on the market are 5 milligrams and 20 milligrams, but with advances in personalized medicine, there are now other forms of administration as well, such as sublingual tablets, sprays, or even subcutaneous implants. Imagine that. However, it is important to understand that Tadalafil is not a magic solution. It is not a medication that works simply by taking it. Like any treatment for erectile dysfunction, Tadalafil must be accompanied by adequate sexual stimulation to be effective. Now you may be wondering, what else is Tadalafil used for? Well, in addition to erectile dysfunction, this medication has proven useful in other treatments. For example, it is used in some cases of premature ejaculation, especially when erectile dysfunction is contributing to ejaculation that occurs too quickly. The insecurity men feel about their erections can trigger a nervous response that, in turn, accelerates ejaculation. In these cases, Tadalafil can be combined with other medications, such as paroxetine, to help control the problem. But its use is not limited to sexual dysfunction. Tadalafil is also used in the treatment of benign prostatic hyperplasia, or BPH, which is a common condition among older men. In these cases, a daily dose of 5 milligrams of Tadalafil helps improve urinary flow, reducing bothersome symptoms such as frequent urination or difficulty fully emptying the bladder. As you can see, Tadalafil is much more than just a pill for sex. It has a variety of applications that many people are unaware of. Now, something that has gained a lot of attention in recent years is the use of Tadalafil in the sports world, especially in gyms. There has been discussion about its possible benefits for improving physical performance, but as a urologist, I do not recommend it for this purpose. There are several reasons why I do not consider it appropriate to use Tadalafil as a performance-enhancing supplement, and in a future video, I will explain this in more detail. But for now, I can already tell you that it is not a magic solution for improving gym performance. It is very common for people to ask what the correct dose of Tadalafil is, and this is where the answer is not as simple as it seems. There is no standard dose that works for everyone. In reality, the ideal dose depends on each patient and their individual response to treatment. Some patients may need 20 milligrams of Tadalafil only when desired, while others prefer a low daily dose, such as 5 milligrams, to maintain a more consistent effect. In fact, some patients use a combination of both, a low daily dose of 5 milligrams with an additional 20 milligram dose when needed. It all depends on what works best for each person. But not everything is perfect with Tadalafil. Although it is a very effective medication for many, not everyone responds equally well to it. In fact, it is estimated that around 35% of patients do not have an adequate response to Tadalafil treatment. If we focus on the diabetic population, this percentage increases to around 44%, meaning these patients are less likely to benefit from the treatment. And in patients who have undergone prostatectomy due to prostate cancer, the success rate of Tadalafil can be even lower. This highlights the importance of an accurate diagnosis and of not expecting miraculous results. Another topic that worries many patients is the dependence that long-term use of Tadalafil may create. Although Tadalafil does not cause physical dependence, it can lead to psychogenic dependence. This means that some patients may feel psychologically dependent on the medication, believing they cannot achieve an erection without it. That is why it is so important not to use Tadalafil indefinitely without a proper tapering strategy, something that should always be discussed with your doctor. But perhaps the most concerning question for many users is whether Tadalafil has serious side effects. The most common side effects include nasal congestion, headache, body aches, and back pain. While these effects are generally mild and temporary, some patients find them uncomfortable enough to discontinue treatment. However, the most serious side effect associated with Tadalafil is priapism, a painful erection lasting more than 4 hours, which, if not treated quickly, can cause permanent consequences. For this reason, Tadalafil should not be used without proper medical indication, as the risk of priapism increases when there is no real need for the medication. Now, it is natural to wonder whether Tadalafil can stop working over time, and the answer is yes. The body can become less sensitive to the effects of Tadalafil with continuous use, which can lead to reduced effectiveness. In addition, if the underlying condition being treated, such as diabetes or prostate problems, worsens, Tadalafil may not be as effective as it once was. In these cases, it may be necessary to adjust the dose or change the treatment approach. So, as you can see, Tadalafil is a medication that, although effective, is not the definitive solution for all sexual problems. It is important to understand that while it offers positive results for many, it does not work the same for everyone, and its use should be closely supervised by a healthcare professional. In the next video, I will go deeper into the long-term effects of Tadalafil use, how to manage psychogenic dependence, and the alternatives that exist. Do not miss it. We will also talk about how you can improve your sexual health without relying solely on medications. The answer to many of your concerns may be simpler than you imagine, and I want to make sure you have all the tools you need to make the best decision for your well-being. Remember, the key lies in understanding your body and how to maintain a healthy sexual life with or without medication. So if you have felt confused or uncertain about using Tadalafil, stay with us. What comes next will be even more revealing. Do not forget to subscribe and turn on notifications so you do not miss the most relevant content about sexual health. See you in the next one.